welcome to another episode of MedSynapse podcast. I'm your host Hetvi Shah, and today we have the privilege of hosting once again Dr. Sudhanshu Mishra, who is an internal medicine specialist and currently a medical consultant at Immersive Labs in Pune. Today, we are diving into a fascinating topic, which is autonomous rehabilitation robots. So, Dr. Sudhanshu, it's a pleasure to have you back with us.
Good morning, everybody.
To start with Dr. Mishra, as we look to the future of healthcare, how do you see these robots impacting the landscape?
Actually, this short talk will complete my three-part telehealth series, in which I'm trying to introduce to India and particularly to the consultant physicians the advances in robotics, advances in IoTs, advances in telehealth, because these are very nascent fields at the moment. But maybe in next to 10, 20 years with chat, GPT and all the AI tools coming, you might see more and more penetration of these telehealth technologies in India as well. Now, I think it was a long gap before my two lectures.
Yes.
You can see them also on the website at your leisure, where I have described medical IoTs as well as other telehealth technologies, which I have described in detail there. Now, today topic is autonomous robots, or you can say healthcare robots or robots used in medicine. These are three terms which we can interchangeably used. And autonomous robots have very nascent literature also, just like ingestion sensors earlier, which I talked about. And basically, they are actually divided into three types. One type which we all see in a tertiary care hospital, that is surgical, in which there is and cyber knife, which we'll discuss on briefly as we move ahead into this podcast. Then secondly, we have delivery robots who help in moving hospital supplies and takes the load of the very busy hospital schedule of nurses, might be GDAs and all these things. Then there is robots. Then there is nursing robots. Delivery robots I already talked about. Nursing robots can basically look after patients, help in movement, as well as can draw blood samples as well. So these two or three differentiation I wanted to highlight before going further into the podcast. And thing is, they are primarily used in European countries. In Japan, they are still to come in India. These two type of robots, surgical, are already there in India for last 5 to 7 years. We already heard about CyberKnife, Da Vinci, and all these things. But the rest of the delivery robots and nursing robots, these also might be used by various good Indian corporates in a few years, or might be in a 5 to 10 years cycle. Depends on what costly they are and how effective they are in Indian healthcare scenario. Plus, actually, this is the question is can be basically modified into in Indian context or abroad. In India, basically we have a good cheap labor, cheap manpower, which we can still get in healthcare. So that might be take bit more time in India, because you have GPs and all these things and nursing. So you have a cheap labor at the moment. But abroad, definitely they are making good strides in converting the very intense, heavy load carrying tasks or any other task to robots, because they want to basically be more quality efficient, and they don't have that much labor, because you might see next 5 to 7 years the healthcare labor is shortly dwindling, and they are not getting the labor with proper skill set. So in India it will take time, but abroad, if I can say, they are definitely in process of getting more and more technologies and more things into these robots, so that they can basically take out hospital other operations function, facility function, and all these things, pantry also, so these, and reception also. So I basically now we let's proceed into discussion, and then we'll tell about more and more detail as we go along.
Yeah, the potential is very immense, I would say. So, with the rise of AI and machine learning, how are these autonomous robots being programmed to adapt to individual patient needs and provide personalized care?
Basically, I will give example of two robots.
Okay.
One robot was in Germany, and another robot was in Belgium. Now the Germany robot basically doubles up the receptionist. Basically, what happens in a busy hospital, receptionist sometimes guide patient properly, sometimes do not. You might have also experienced going into a busy hospital setting where you are asking where is that lab, where is that medical room, where is particular rooms or not. So sometimes you also feel bamboozled when the receptionist try to ignore you, or basically you have to run whole hospital building. You get 4 or 5 circles hospital building, not finding the designated room. So for that, in Brussels, they have devised a robot which doubles as a receptionist. It has 20 it can understand 20 languages, as well as it can understand whether the voice is of male, female, or a kid, and then direct according to room accordingly. For example, if I have to go to a biomedical or CSSD, the robot will direct me how many rooms it is CSSD, and will show the floor schematics also. So these type of robots are there who basically saves the hassling of a receptionist. Secondly, I will tell there is a very good robot in USA, and that basically acts as an animal. See, animal therapy in dementia and schizophrenia and old age patients like Alzheimer's and all these things, particularly in dementia, I can say. Other two are in the research domain as well. Basically, what happens is there is a robot which serves as a dog, known as Paolo. It is a code name Paolo. Yeah? So basically, what it does is, as an animal, you might have, also have pets in your house. So that way, the dementia patient or an old age patient or rehabilitation patient can touch feel fur like a dog. All the furs are feel real life and all these things, and basically cuddle and all these things can be done. So these two type of examples we wanted to highlight, because robots are now in every field of healthcare, and these are classified into nursing robots. Now delivery robots, I can for example, a hospital like Medanta, it generates huge biomedical waste every day. There might be basically transportation of consumables like injections or drugs and all these things. So in basically Brussels only, they have a robot which basically doubles up as a GDA or housekeeping staff, and basically helps to transport materials from one place to another. So these two or three types of examples, you can understand that robots are really increasingly used in every aspect of the area. And rest of the types of robots we'll explain as we go along. But definitely they have very good potential. Plus, with the AI based world coming in the next decade or so, you might see more and more robots penetrating into healthcare sector.
Yes, that's truly remarkable. Now, how do you think advancement in sensory technology will enhance the capabilities of rehabilitation robots in providing more accurate and responsive support to patients?
Okay, so basically here also I will proceed with 3 robots. The first robot is a sample taking robot. It can take blood samples by basically localizing pinpoint the vessels by using infrared as well as ultrasound technologies, and can take a sample without any human contact. It might seem fictional, but these type of robots are there. It was made by MIT scholar, and they are in trials. I think phase 3 trials are still going on in that, and hopefully by next 4 to 7 years you might have a blood sample taking robot in India or South Asia market. Then secondly, surgical robots, which we have not talked about, because surgical robots are basically known to almost every robotic surgeon or minimal access surgeon already. Basically, surgical robots have a fine precision which is much beyond human capacity. Of 1 mm, 2 mm precision are there, and they can be remotely controlled by the surgeons. The most two examples are Da Vinci robotic system as well as CyberKnife. Now, CyberKnife also helps in giving radiation, and also taking basically detecting and taking samples from the prostate cancer, from liver, and from other organs where the basically the surgical approach is basically not possible to at a minute degree, where you need very minute precision, even in spine also. These type of robots are helpful in taking biopsy and samples, and eventually help in getting a good field of vision and good surgical closure. So these surgical type of robots are present in Indian market. Even you can go and ask in Fortis, Artemis, Hiranandani, and all these things. They have CyberKnife and Da Vinci's robot system. So you can observe themselves that also. Now, regarding the other two types, the delivery type and nursing type, they are still in Europe and USA. They might come to India maybe in 4 to 5 years. Depends what type of jobs and what type of technology becomes cheaper, because they are not quite cheap. They are in the range of, I think, 50 lakhs to 1 CR a robot, and that to be modification according to the hospital needs. So let's see when it comes to India. And also, lastly, a disinfection robot is also there, which is in USA very frequently. In COVID-19, when everybody was basically avoiding human contact, These type of robots help to disinfection, for example, a CT room in 15 minutes compared to a radiographer who can basically fumigate the room in 1 hour. So these type of robots are definitely trying to basically make the jobs of doctors, nurses, and other healthcare professionals easier by doing this menial or repetitive tasks, and with ensuring increased safety of the personnel as well. So I can say that in Indian landscape, it will take around 4 to 5 years minimum.
That's fascinating. Now, looking back over the past decade, can you highlight some of the significant advances in the robotics autonomy and how do you foresee these advancements in impacting the development of assistive technologies?
Actually, initially these robots were used in industries. The first time it was used in healthcare was in fumigations and rehabilitation, as you rightly pointed out. In rehabilitation, there has been robot, as I already talked about, Paolo. That is a robot which acts as a dog or animal. Any animal it can mimic. And from animal therapy, it has been shown neurologically the patients of dementia and Alzheimer's can benefit. Initially the robots were not accustomed to a very definite amount of tasks. That time the sensors are not that great. And initially it was used in only for a wheelchair patients, rehabilitation, exercise, and all these things. Now in last 7 to 8 years, we are seeing very beautiful rendering of the precision systems and robots basically almost taking over that work of a person in whichever healthcare setting he is or whichever department he is in. For example, disinfection can be done by robots, animal therapy can be done by robots, medication delivery, sampling, and all these things are be done by robots. So there's a huge increase in more functions awarded to rehabilitation or autonomous robots, and types of sensors have much improved. Let's say 5 to 7 times improved in basically precision command movements. Because robots earlier were not able to get precision command movements. Like for example, if I say robot to lift a drug and transport it 500 meters, the precision was not so beautifully there. Now, in 5 to 7 years, it has increased, and now the precision is very much there that they can also help in hospitals day-to-day work.
Yes, the progress is very much. Now, what role do you think virtual reality and augmented reality might play in enhancing the effectiveness of rehabilitation robots?
There was a talk. There was, I think, in MIT and Caltech, there was a researcher who was using VR-based teleconsultations, in which basically you just need to have VR-based goggle, sorry, Oculus Prime, and all these things. Google Glasses, I can say an example. Google Glasses are now going out of fashion, but it was very revolutionary technique that time. Around 5 to 7 years, there were Google Glasses, there was Oculus VR as well. So you can just apply a VR type of prosthetic, or it is just like a spectacle, and you can feel the whole virtual hospital at your doorstep only. And from there, you can consult with the doctor, ask any questions, and basically he will also be able to. Basically, you will feel that you are just near the doctor only. That feeling is there. So VR and AR based technologies are in development. Although in India it is within the nascent stage, in US they are having Google Glasses, Oculus Prime, and all these things. So these VR Oculus, so these type of things are might be present in India, but that too they are mostly imported, and a very limited set of people might have that. But there is a definitive role of VR in addressing a teleconsultation where a doctor can feel at almost at a touching distance of 3 to 4 feet from yourself, and you can have a very good teleconsultation at the comfort of your home. So that technology is definitely there.
Now, doctor, in what ways can autonomous robots improve the efficiency of healthcare providers and reduce the burden on caregivers in managing patients with severe motor impairments?
Like I already earlier talked in the lecture, basically rehabilitation, they have multiple robots. One robot is animal therapy. Let me describe the animal therapy in detail. For example, even for us also, we have a pet like dog. Dog is there, or might be some other animal also. So you can cuddle with it, you can interact with it, and you do not feel lonely. Same way, Paolo Nam robot is in US to basically help the patient of dementia recover. And then there are other prosthetics also. Earlier in wheelchair also there is prosthetic. Then there are robots which can lift up the patient. They are weighing 140 150 pounds. One in Japan is there, one in Czech Republic is there, in Brussels is there, which will basically help in patient lifting, prevention of bed sores also, because bed sores are very common in moribund patients. Around 7 to 8 days there might be development of bed sores. and they basically help in moving patients, moving drugs, moving devices, moving other consumables from one floor to another quite efficiently. So these type of things are being replaced by robots, and as I already said, world over there is a huge demand of these type of robots in particularly doing these type of things in hospital. They can almost do 50 to 60% of all the ancillary services a hospital provides, like housekeeping, reception, even drawing blood samples can take the load of nurses in a very busy hospital. So these type of things are already in place for robots, and we might see more and more technology advanced robots going into treatment direction as well. There are in Durham there is a robot which can dispense the medicines according to a prescription and also help in patient being compliant to that medication. So in Europe, there is a definite demand of these robots replacing all the routine day-to-day works of many workers. In India, the major concern would be our healthcare is cheap compared to other developing and developed countries. So it will take some time to get a robot instead of 4 or 5 human personnel, because it basically has there is a job fear also, because robots then do things perfectly. The ancillary of support staff might not be required in that number. So that is the thing which might be holding the adoption of robots. The robots can fumigate an entire ICU or OT within 15 to 20 minutes by their own. So these type of things might come in the future. But as they say, in India, mostly labor intensive tasks, even if you can compare, the small petty tasks are done by this healthcare workers or ancillary services who are basically picked up for a very cheap rate. So let's see how it adoption goes soon.
Yes, thank you. Now, finally, can you tell us what are some potential challenges or limitations associated with the integration of autonomous and rehabilitation robots in healthcare settings, and how do you propose overcoming them?
The challenges would be in areas which are directly basically addressed by physician. For example, let's say they offer more and more go to therapy areas, and they can take blood samples, they can measure temperature and all these things. So these type are still in development stage, I must say. But in future there might be challenges, as I already said. In resource intensive countries, it might be a good proposition to hire a robot for receptionist or for transporting medical supplies elsewhere. But in India, the main challenge would be, one is the cost. These costs are minimum 50 to 1 CR. Secondly, you have to replace more and more workers who are cheaply paid, let's say 20,000 general duty assistant or a 30,000 nurse and all these things. So these type of things challenges are there, because in India the job losses would be huge if robots are brought in all of suddenly, and that is a challenge. Thirdly, the technology is still diagnostic. As I already talked about, ingestion sensors also. Ingestion sensors were used for GERD and all these things, and eventually they have also been not adopted by Indian personnel, because once there is a cost, then there is a human interaction which they are avoiding. Thirdly, labor. How many jobs are they going to consume of Indian healthcare space? So these 3 or 4 challenges are in the healthcare space. Technologies are going on, particularly in Germany, Scandinavian countries, as well as in UK, France. They are definitely using robots in the infirmaries, but still they are far and few in between. But what I can say that with definite, after this decade, 2030 onwards, when AI and Chat GPT and all these technologies will start to replacing even software engineers also, you might see even in hospitals adoption of these robots replacing many manual work laborers. So that is the challenge we have to contend with, because any hospitals are now running for profits also, and plus they want to lessen the burden in the direct healthcare providers like doctors, nurse practitioner, nurses. So these type of challenges are there. And thirdly, I think the regarding data encryption and all these things that I already talked about in my first lecture, they cannot be done open source. They have proprietary model, which is costly, which is having a huge maintenance cost also. So I think once robots are manufactured in say multiples of 1,000 to 10,000 per year, then might be overcome the challenges. So it's a nascent technology, but it is very promising, and hopefully it will come to India next 5 to 7 years, which I can say with definite. And let's see what the future holds for us.
Yeah, right. Thank you, Dr. Sudhanshu, for imparting your insights on this captivating topic. It's been a delight to have you on MedSynapse with us once more.
Oh, no, ma'am, even I will request my audience to have a suggestions. If they want suggestion on good topic on telehealth,
Yes.
MIOT, robots, they can fill in the comment section. So we can describe them later. Also have a separate session for that. I'm looking forward to the comments also. Thank you, MedScience, for providing this opportunity to having me a three core. This is a three series of lectures regarding modern telehealth technologies. I'm grateful for that.
And many thanks to our audience for tuning with us today. And if you are a healthcare professional with questions or an interest in exploring more medical topics, remember to connect with us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. Until next time, stay curious and stay healthy.